Welcome back to Me Time. My name is Megan, your host, and today's episode we have a very special guest on. Her name is Baldeep Dhaliwal. Baldeep is a current PhD candidate at Johns Hopkins University, the Bloomberg School of Public Health. She has obtained her Master's of Science in Public Health also from Johns Hopkins University, and she has her Bachelor's of Science in Neuroscience and Cognitive Science from UC San Diego. She is a first-generation college student and also a Fulbright scholar and alumni. Baldeep is here today to discuss her transition from undergraduate into her master's program into the workforce, and then determining when she wanted to go back to become a PhD candidate. We're going to be talking about some of the highs and lows of applying for PhD candidacy. We're also going to be discussing the financial burden of it and some of the nuances of PhD programs. So I hope you enjoyed today's episode, and welcome to Baldeep. Welcome, Baldeep. I'm so happy to have you on. Thanks for coming.
Thank you so much. I'm so happy to be here.
So Baldeep and I have, throughout the years, both been kind of chatting about our processes. We both went through master's programs, and we were roommates at the time when Baldeep was going through her master's program, and now she's going through her PhD program. And then in the past, we weren't living together then, but I also went through a master's program myself. So today we're just going to be chatting a little bit about like financial aspects, because that's something I feel like we both talk about quite a bit, the financial burden of school, and also continuing our own education, and then also just a little bit of nuance into applying for programs and reapplying for programs as well. So yeah. Do you want to tell us a little bit more about yourself, Baldeep, and your background?
Sure. My master's in public health, or it's a master's of science in public health. I did that. It focused on health policy when I initially was planning to do a little bit more domestic focused work. And then I did do that for a little bit. And then I kind of decided that I wanted to get more experience doing more of the research side as opposed to like domestic policy implementation. I kind of wanted to understand the baseline research. So I started working at Johns Hopkins at the International Vaccine Access Center to kind of do research that would eventually lead to policy implementation, but kind of started at more of the ground level of research, which eventually kind of took me through to my interest in applying to a PhD in international health, which is what I'm in now.
So when you went to your bachelor's program, did you even know that this is what you wanted to do? Did you have any idea that health policy or more of a research-based focus in academia was where you were going to go, or like what were your thoughts going through your bachelor's program?
Yeah, not at all. I wanted to do so many different things when I was in my bachelor's program. When I first started, I wanted to be a pediatrician, which I don't even know if you knew that actually.
I didn't know that.
Yeah,
I didn't know
I
you wanted
wanted,
to be a pediatrician.
oh my God, I wanted to be a pediatrician more than anything. And then now I'm just like a hypochondriac. I'd be the worst doctor in the world. So I'm like, I can't do that. Sorry.
Wait, what changed? Were you like growing up? Did you always want to be a pediatrician? And
I
then
think it's
you
just like,
was this supposed to
yeah.
be a pre-med track that you in your undergrad? Was that supposed to be pre-med, or you just weren't sure yet? You didn't think, or you
I
weren't
went
sure?
in like with the intention of, so I was like, okay, I'm pretty sure this is what I'm going to do. And then I ended up changing my mind. I don't even know if you know some of this. That's so funny. I ended up changing my mind a little bit. Like I got involved in student government, and then I was like, I'm going to go to law school. And then I for like a year wanted to go to law school. And then,
Oh.
yeah,
I knew about the
so
student government because you were student body president, right?
a senator, just a senator. But
Senate.
yeah,
Okay.
I was
Okay.
senator for 3 years. But yeah, so I wanted to, for a while, I wanted to go to law school and get into like policy. And then I kind of dropped the law school thing. I was like, oh, this isn't what I want to do. But then I was still interested in policy and healthcare. I was like, how can I kind of merge these, which is how I ended up going into a master's focused on research in health policy, because that kind of seemed to blend a lot of things I was interested in. Like I was still very passionate about healthcare and ensuring that like, you know, kids and adults were healthy.
Mm.
And then also access to care became like a big interest of mine. And then I was still interested in kind of like the less individualized care and more on kind of the big picture. So it kind of brought me into health policy. So it was quite a journey, actually. So my bachelor's, initially considered this is what I was going to do. It was like maybe my third year that I kind of pieced this together, that this could be a career for me.
And what do most people who go into the Bachelor of Science in Neuroscience and Cognitive Science studies, I mean, what is the path that most students come out, and do you go straight into the workforce? Like, what is the trajectory of that type of Bachelor in Science? Like, I don't know
Yeah.
many, I don't know many people that have done that track.
No, it's really it's pretty unique too, I think, too. It might not be offered everywhere, but yeah, cognitive science, it still is like a not new field, but I would say it's like more emerging, more developing
Hmm.
still. So I think a lot of people that go into it go in with the intention that they might go into like neuroscience research with a slightly
Mm-hmm.
more behavioral lens, which is kind of some of what cognitive science does. And I think a lot of people also do it as like a grounding for medical school as well. So
Yeah.
I think I would say most people kind of go into those two buckets of like research
Mm-hmm.
or practicing care. I'm trying to think if or into like teaching, like some people kind of went into the academia route, but not necessarily like the research route, but more of like the educational route. So that would
Got
probably
you.
be like those are probably like the three main categories I think people would go into.
Did you have like family push to kind of go in a pre-med direction at all, or was it like did you grow nobody in your family is in the
No,
health field,
no
right?
one's
Or
in the
the
health
okay.
field. No, it was just kind of something that I was like, oh, I want to do this. Like,
Mm,
care about, I guess maybe even at that age, like I care about like people being healthy and like,
yeah.
people having like people having, I mean, my mom had like health issues growing up. So I think maybe that always kind of pushed me to like, I
Okay.
want to go into a field that like you can help people like that. But then it kind of is, I wanted to do something at a little bit more like systemic level, I think, and more about the policies that impact people. Because I think people, like you who provide individualized care, that's amazing and so powerful. I don't know how you do it without thinking like every time you see a sick person, I would be like, oh my gosh, I too will be sick. So I'm like, so I think health policy was kind of nice because it let me be a little bit like detached emotionally, which sounds bad. Okay, maybe you should edit some of this out. Um,
No, I get what you're saying though. Like to be
yeah,
removed and focus on the policy to make it a better policy in general for everybody. It's like so you don't have to
yeah,
do that individual. You're doing individualized care but on a larger scale. So for the greater good, right? And that's technically
yeah.
what government policy it's supposed to be.
That's what I was hoping. And then also like being in that kind of policy role, it's okay, well, maybe like by addressing these larger systemic issues, it'll go down so that these individual issues aren't as
Mm.
prominent and they're being addressed more. And by ensuring like access to care, then people can access primary care that they need so that they don't end up in these serious advanced conditions.
So, from your undergrad programming going into your master's program, how much time off did you take? And because I knew you were helping in the DC network or with
Mm.
insuring people, making sure that they had access to insurance and helping them figure out which insurance was best for them. Is that correct?
Yeah, on that DC Health Exchange. Yeah, so through Obamacare, that was what I did actually after my master's. I did
Oh,
that.
yeah, yeah, yeah.
Yeah, yeah. So between my bachelor's and going to my master's program, I didn't really take time off. I applied my fourth year of college and um, I was accepted. And then I was kind of weighing different programs and picked the program that I thought provided like the skills that I was looking to develop the most, which kind of goes into something that you said earlier about like deciding these paths and the financial decisions because it was such a big financial decision, which I know
Yeah.
you felt too in your master's program. Like deciding to take on that student debt was not something that I wanted to take lightly. So I weighed my offers with the financial
Mm,
costs as well as the curriculum that I was going to get and the skills that I was going to develop. Like you kind of had to consider all of those pieces before making a decision to go in. um, so after I did that and I decided that this is what I was going to do and I was going to pursue this program, I didn't take
hmm
time off. Like I had the summer off between graduating and starting school, but I didn't necessarily take like a gap year to do any
That
work
must
or
be like,
anything.
I would imagine it'd be really hard. You're in your undergrad program, having to apply to grad school programs, and then you move cross
Yeah.
country too. So it was a new location, a new city. also
Yeah.
having the thought of like, I think, you might get your grace period after undergraduate, but then you go right into having to pay for grad school loans too, which is overwhelming. And then having to also figure
Right.
out what you want to do with your life and making sure that your master program is the direction where you want to go in too. So
I mean, we're
I
like
don't know.
considering all this at like 20, 21.
Exactly.
Like it's a lot to kind
And
of like weigh and figure out at that time. So it's, everyone who's kind of going through it, people who are applying to like medical school and law school and like nursing programs, everyone who's kind of going through that at the same time, it's a lot to expect of like 20-year-olds and 21-year-olds to kind of make these big decisions and these financial decisions, which is something that I think we don't talk about enough. That people think like, oh, this is the direction I want to go in, so I'm going to pursue that, which is, of course, very important to figure out like where your passions are, but also these bigger decisions on, is this going to be worth my financial investment? Is this going to be worth my time investment? Like that's something that I wasn't thinking about as much as I think I should have been. I mean, I was considering it. I was like, this is expensive, but I think it would have been more beneficial to have like, I mean, now if I was thinking about it too, like, it's
we're
much
older.
more,
We're 10 years older,
we're like
too.
more prepared to kind of think about.
We're aging
Yeah,
ourselves
that's what
on
I
here,
didn't want to
but
be like,
no,
well,
it's
now we're
true.
old.
But it's true. Like, I don't know, like think about it now. Would that have changed a decision though? Probably, maybe not. But also at the same time, if that's like the academia path that you have to go, you're kind of almost stuck in this position where you're going to have to get your
Yeah,
master's whatever path that's going to be. So I don't think you regret getting your master's, right? Obviously not, because
exactly.
you're
No, not at all. It's like slightly painful when I log into Nelnet, but other than
it haunts you.
that, other than that, I don't regret it. It just haunts me. It's always like looming there, but other than that, it's not something that I regret at all. But it is something that yeah, that should be considered and kind of weighed. And what you were just saying about like, if this is the career that you're deciding, it's kind of, you're not really left with too many choices. If this is like you're pursuing academia, you need a master's. If you're, want to advance in academia, you need a PhD. There's very limited
True.
like
Yeah.
choices
And
involved for you.
I guess for a master's to your PhD, obviously those are very different programs as well. And PhD is definitely a longer program usually.
Yeah.
I guess how did you, now that you had your
Yeah.
master's education, you were doing more master's focused public health work. Can you talk a little bit about what
Yeah.
was the catalyst towards you deciding on a PhD program, and how long did that take for you to realize, and did you put it off? Once you recognize it, did you
Yeah.
apply right away? Can you talk a little bit about that process for you individually?
Yeah. So after my master's, which you mentioned earlier, I worked a little bit. I worked for about 2 years at the DC Health Exchange, where I was providing or working on this like kind of large scale access to care, helping people who were on the Affordable Care Act on the DC Health Exchange accessing care. That was kind of my big role, serving as a healthcare consultant. In that role, though, I kind of realized that I wanted to go back into research. So, what I first did, and I'm sure our lovely host Megan remembers this, is I decided to apply to PhD programs, and I just kind of went for it. I thought that the application process would be very similar to like a master's application process, where you have your good GPA, you have your good GRE scores, you have your strong letters of rec, and you're a good candidate, you're going to get in. Megan, I didn't even get one interview that cycle because it was such a different beast. So I did reach out to one of the programs that I applied to where I didn't get in, and I asked for some feedback, and they were very helpful and very honest. And they said that, like you're applying to a very rigorous research program, and you're going to have to commit like 4 or 5 years of your life to doing research, and you haven't really shown that you're ready to do that kind of commitment because you did your master's, you have the academic background enough, you have the training, but then after that you worked in like the private sector. Like, how do we know that this is going to be kind of a good investment of us investing in you as a PhD student if you don't have this like history of doing it? Which I thought was a really good point. So then I started applying to positions like in DC and then also in Baltimore, where I ended up getting my position. But I was looking for a position where I could kind of get this research experience and see this is something that I wanted to do for, an extended period of time
Yeah.
or theoretically for the rest of my life. So then when I started the position, I ended up getting an offer at Johns Hopkins in the International Vaccine Access Center, where I could kind of get a chance to do research, but also policy implementation, but much more on the research side. So like you do this formative research to advise policy recommendations. And I thought that was a good place for me to kind of merge my background that I already had with new skills that I needed to show that I could showcase. So that's kind of how I got into research. And then I reapplied to PhD programs after several years and a few frustrating experiences, which kind of like pushed me towards the PhD. But I reapplied with much more research experience and proving that that you can do it.
Right.
Because that's what a PhD is really looking for. Like, are you able to do rigorous research? Like you have to show a history of that. And
I
when I
see.
applied
So
the
we're
second time, I did.
time wise, I mean, initially, were you surprised by the feedback that you got from the PhD program? Like, did it kind of change? It sounds like it changed your total perspective of like the PhD program itself and kind of gave you like a
Totally.
direction almost to work towards. You're like, okay, now I need to find a job that's going to help me get to this PhD program site, but also help me understand what I want to study too.
Exactly. No, it totally did that. That conversation was actually really pivotal in just kind of helping me think about what it means to pursue a PhD. And now that I'm in one, I really understand that it is not like a master's program where you show up to your
Mm-hmm.
classes and you do your homework and you take your exam and you just get your grade and move on. It is so much more rigorous in terms of like research thinking and independent thinking and working independently and analyzing data independently. It's like much more of a emotional, mental, everything commitment to a degree than I could have expected. So the first time I applied, I just applied going into it thinking, oh, this is
Mm-hmm.
just like another degree that you do. And then now that I'm in the thick of it, I'm like, this is not just another degree, and this is kind of what I now understand. So yeah, that conversation was really pivotal.
Wow. Was it a hard realization to come to the conclusion that like, wow, I'm really not ready for my PhD program yet? Or was it kind of a breath of fresh air saying that, okay, I have an opportunity to spend time to focus into another direction or a different direction? I don't know. How did you take it? Because I think I would feel very like that would be hard to take and spin so positively. Obviously, it's been many years since this has
Yeah,
happened, but
I know. That's what I was gonna say. I was like, well, I'm sure now I'm talking about it like, it was this like enlightening experience, but I'm sure I probably came back that day and was like,
oh, did you
she
meet with
was
them in
so mean to
person?
me.
Oh, I was gonna say, wow,
No, no, no. It was a
wow.
phone call. It was a phone call. Thank God. No, that would have been very bold. But no, I think at the time I remember it's not a great feeling to be like, well, you just like aren't ready for the program. But then it's constructive, right? To be told like this is where you need to work on things. And it wasn't even like, oh,
Mm-hmm.
you're just not a good candidate and that's it. It was like you could be a good candidate if you can show that you can do X, Y, and Z, which I think
Yeah.
I really appreciated that. Shortly after the
Yeah.
conversation. And then in hindsight, I really appreciated it because I think it's so important to have people who are honest with you and like where you need to improve
So,
to
how many
succeed.
years was it between the first time you applied and the second time you applied?
Let's see, I worked for 3.5 years at Hopkins before I started the program. So I think it was about maybe 3 years between my first
Okay.
application and my second application. Yeah, actually, that sounds right. Like 2017 to 2020. I think that's right. 3 years of like
And
intense
did
research
you apply to the
experience.
same programs or total
Yeah,
different programs the second time around? Wow.
completely different, actually. The first time I applied to health policy because that's what I thought I wanted to do. And then the second time I applied, I actually almost exclusively applied to like global health and international health programs. But because that's kind of the field that I
Mm-hmm.
ended up being very interested in and wanting to pursue. And I still do policy work, so I still have policy experience and I'm still in the realm of trying to merge those interests, but it's something that I wasn't expecting. And it was only through kind of that research experience that I was told that I needed, that I was able to kind of find this other niche of working in international settings, and somehow bringing my policy background into it would, give me a space to do
And
really
these
well
programs
and
for
learn
your
in.
PhD, what's the average? Are they all like on average 4 to 5 years, or is it just however long it takes you to complete your research? What's the like time commitment expectation for these programs?
Yeah. Typically, at least the programs I was applying to pretty much only guarantee like 4 years of funding. You might be able to finagle 5 years of funding, because the PhDs are almost always fully funded for your tuition and
Mm.
for your health insurance. Beyond that is not guaranteed, but your tuition and health insurance is funded, which is why um, I think,
Can you share some of those
yeah,
numbers? Like, what
anyway.
does that look
But
like
yeah, so
for?
the
So
tuition,
tuition obviously is huge. I mean, that's the chunk, the largest chunk of any
yeah,
money that a university, I guess, could forgive in that sense. So that's great. But are you always expected to
yeah,
also in tandem? So you're expected usually to work for the university by teaching coursework, right? For undergrad or master's students. Is that correct? Is that expected of everybody?
yeah. That's pretty much. Maybe I can just speak to my program because but
Mm.
it is expected at Hopkins and the public in school public health, that you are expected to TA courses. That's kind of an expectation, and the expectation is also that you do research and funding or sorry, things that kind of make your funding worthwhile for the university, because it's a big investment on their part. Like what you're saying was totally right. I think the tuition at Hopkins per year is in the 60,000, 70,000 range. So if they're funding 4 years,
Yeah.
that's $280,000. It is a huge investment for them. That doesn't even include your health
True.
insurance that they also pay for every year. From the university's perspective, like they're investing $300,000 in you, at least at Hopkins. Like, they want to know that they're somehow getting their money's worth, that your training is being used to kind of advance the field of public health or the field of global health. And that also, but in the other ways too, that like, you're also teaching, you're making a
Hmm.
contribution to the university, you're doing research that like makes the university kind of, advance their research portfolio too. So I think in lots of different ways, like they want to see a little bit of a return on investment in a PhD
I know
education.
you, Baldeep, are working in
Yeah.
addition to your PhD program. So you're teaching courses, you're TAing courses, you are doing your own course
Yeah.
load and
Yeah.
your own research, depending on what year you're in. And
Yeah.
then you can choose to work on top
Mm-hmm.
of that. That wasn't part of the PhD requirement, technically, right? I would assume most people work though.
Exactly. So it depends. Yeah, it depends on the program. So some programs have a work requirement. So one program that I maybe will not name names, but when I was considering programs, there was one program that offered a very meager stipend, like
Yeah.
below poverty line stipend per year, and it came with a work requirement, an 18-hour a week work requirement. And as students, you're not permitted to work over 20 hours a week. So basically that was all you could do for your $14,000 stipend. You had to work 18 hours a week.
20-hour work week, is that like across the board for
Yeah,
universities? Or is that port for that one university?
pretty much.
Okay.
It's pretty much across the board. I've never heard of anyone being allowed to work more than 20 hours a week as a student in a university while you're in
Okay.
term. If you're out of term, you're allowed to work more. But in during like the session, the semester, the term, whatever your school uses, yeah, pretty much everyone that I've heard, anyways, capped at
Okay. So
a
even
max of
if
20 hours a week. Or I think it's like
I
19
mean,
and a
that's a
half.
good point. It's a good point because, like, if you're working full time, how can you be investing in your own education? It's really difficult to like find that time working full time.
Exactly. Exactly. So it's a good protection for students, but it is kind of tough because like these PhD programs you're not necessarily guaranteed a stipend depending on where you are. So Hopkins doesn't have a guarantee for stipends at the School of Public Health, at least. I guess I'll speak to the School of Public Health. Um, some people get them, some people don't. So there is an expectation that you kind of need to work to be able to pay your bills because, like we talked about, like they'll cover
Mm-hmm.
your tuition and your medical insurance, but they, aren't necessarily helping you pay your rent and pay your electric bills and,
Right.
pay for your groceries. So yeah, I have worked in addition to being in the PhD full time. I've been like working at the maximum capacity of
Oh.
a student. So just because,
There's bills.
there are
Yeah.
like, how else would you
You
pay
bought a
your
house. You
bills?
got things.
Yeah.
Yeah,
I'm
Baldeep
like,
bought a
I got
house.
bills to
That's a big
pay.
deal. There's bills to be paid. Yeah.
Yeah, yes, that was before school. Before school. So yeah, there are
What's
bills that need
the,
to be paid.
it's just, so are your like, I don't know what your situation, you don't have to like speak to your situation, but what happens when you're in your PhD program? Do you pay your master? Like, is everything frozen that you don't have to pay any student loans and it just gets frozen until you graduate
Yeah.
your program?
So technically, so yes, I'm not required to make any payments. However, the interest has not paused. So the
Yeah.
interest
Okay.
is still accumulating. So I am still making payments. So I mean,
Right.
luckily during COVID, like it was all on pause. So I didn't have to worry about that for like the first 2 years of the program.
Great
Like my
timing,
interest
Baldeep.
was just
Great
sitting
timing
at
on your
zero.
end to go into your PhD program.
Thanks. I knew what I was doing. I totally knew what I was doing. This is why I did. This is the real reason I didn't get in
It wasn't meant to be.
2017.
Definitely wasn't meant to.
It just wasn't meant to be. No. And I
Yeah.
firmly believe that. I not to like be very like spiritually. I feel like it
Mm-hmm.
was very much not meant to be at that time. I think I'm in a much better place. Like I guess like education wise, and like I feel more prepared to take on a PhD now than I
Yeah.
think I did in 2017. So I think it was a much better time for me. But
Oh no, I was just saying like if payment was not on pause, so you're getting interest, you still have to pay interest, and then you're still not making a lot of money as a PhD student. So it's like
yeah,
a huge financial investment, and it's an
exactly.
investment for your future. Like I feel like you have to be very certain that this is what you want to do, because I don't know why go through 3 years and then decide you don't want to complete your PhD. I wonder. And then it's a very rigorous program. Like I think there was only, correct me if I'm wrong, but they only accept like a very few handful of students a year, like one, or did you say two students a year?
Yeah,
That's
when I
that's
applied, there was
wild.
only funding for two students. So I applied during like the Fauci effect year. I don't know if you've heard this term, but like in 2020, so many people applied to like medical school and public health programs and nursing. Like people were like very invested in going into healthcare. I think it's kind of waned a little bit. I think it's back to normal. But at 2020, so many people applied. So they were very clear in the interviews that they're like, we've had we have like double our normal applicants
Wow.
and we only have funding for two students. So they were, at least the program that I'm in at Hopkins, that's what they said during the interviews. They're like, we have double our normal applicants and we have two spots. So best of luck to you. Let's
Wow.
start your interview. And I
So,
was
do you
like,
mind talking a
awesome.
little bit about the process of like the interviews, like what you did differently compared to the first time? So, yes, of course, your professional development was huge. You were
Yeah.
working more towards your field. You showed evidence of research, but from the application standpoint,
Yeah.
what
Yeah.
did you do differently this time that you feel like helped you obtain a position, obtain a spot?
Yeah, yeah, good question. I took a very different approach. So when I applied the first time, I
Mm,
hadn't done any outreach to professors. So when you're applying to a PhD program, you basically are applying to like work with one person. So I had read their bios on the websites and I thought, this person looks good. Maybe I'll work with them. But then when I applied, and it didn't pan out the first time. And then when I reapplied, I knew exactly who I wanted to work with. I had already set up, like the summer before I applied, I set up all these conversations. I had conversations with them. I was also very frank that, like, I want to apply to PhD programs. Are you accepting PhD
ah,
students? Do you have funding for PhD students? So I was very direct in what I asked them because, there was one person I talked to at one university who she was very honest, which I appreciated. When I asked her, I said, I want to apply as a PhD student, but do you have funding and are you accepting students? And she told me, she's like, look, you seem great, but I don't have funding to take on a PhD student. So you can apply when the application eventually comes to me. Like, I won't have a choice because I don't have funding to take on a student. So I was like, okay, that's good to know. And I didn't apply to that school because the application fee is very expensive. Like, I'm not going to pay
that's
to
the thing too.
apply
You still have
where,
to pay to
oh my
apply and then
God.
to travel for your interviews.
Yeah.
I forgot about that portion of
Yep.
the process.
Yeah.
And then, so
Yeah. And
Yeah,
paying for like your
true.
transcripts to be sent, paying for your GRE scores. You have to pay
What
for
and
everything.
so it's not by the school per se, or maybe it's the subspecialty of the school. When you said that you found a professor that you wanted to work with, or that you think you would want to work with, and she liked you, but when they didn't have funding, is that
Mm-hmm.
because her department didn't have funding? Is the funding not coming from the university? Like there's not always a PhD opening every year. Basically, is that it's variable per year? Because you kind of mentioned, okay, it could be two one year, but
Yeah, it's very right. Yeah, no, it's variable per year. It's variable based on the school. So, like at Hopkins, for example, where you get your PhD funding from, it might be the department, but more likely than not, it's someone's like grant money that they're using to fund a PhD student,
oh,
or it's somebody's like center that they're using to fund a PhD student. So it's very dependent on the school. So where she told me she doesn't have funding is because they were a grant driven school. So she didn't have a grant that was big enough to cover a PhD student. Because like we talked about, it's like almost $300,000. And she was saying my grants don't have a
yeah.
casual $300,000 sitting around to take on a
Yeah.
PhD student.
Wow. Okay. So, as second time around, you're individually
Yeah.
reaching. So, you have to do a lot of, first of all, you have to do a lot of legwork as a PhD. It's not like a master's program where you're applying
Oh,
to multiple
yeah.
programs. It's not like yeah, you look at ranking and how they're going to help you, what's their community outreach, their alumni network.
Yeah.
But at a PhD program, it's like you have
Hmm.
to wait for a spot to become available. You have to do the research to find out if the spot's
Yeah.
available. Is it online somewhere? Like, how do you
Yeah.
know about,
Yeah.
is it advertised?
So, like, no, I would look up like the bios of people who I was like, oh, this person does research that aligns with mine. And then I would send them an email and say, like, oh, my name is Baldeep Dhaliwal. I'm currently working here. I'm very interested in your research and potentially pursuing a PhD at the university that you're at. Would you be willing to set up a time to talk with me? And I'd have to set up these informational interviews with all of these faculty at schools that I was even considering applying to, because you have to kind of establish this relationship almost to, be considered, because otherwise,
Is this like something that they're expecting on their end of things? Like this is like this is just what PhD students do, or like prospective students do.
yes, which makes it very hard if you're so like me, like I'm, first generation. My parents did,
Mm-hmm.
like first of all, immigrated to this
Mm-hmm.
country, definitely don't have PhDs. So I had no idea this was an expectation, but it is. And apparently it's a very known expectation that I did not know. The first time I applied, I didn't do any of that. I just kind of was like, oh, I would like to work with Dr. This person. I would look at their bio and say, like, this is why. And then I didn't realize that when it gets to them, if they're like, well, I don't know this
Yeah.
student, they've never reached out to me, why would I want to work with them? Like, and I mean, I can't say that always happens. Like, maybe something in an application of someone who hasn't reached out really speaks to them. So they're willing to take them on an interview or anything. But, I don't know that that always happens. And when I reapplied the second time, like when I kind of knew this was an expectation, I mean,
Yeah.
it went much better. I went from no interviews to two offers. So it,
And the informational interviews that you do, were they awkward? Like, was this over video?
yeah,
Was it just over like you're totally cold calling, but cold calling via emailing, being like almost like
yeah,
spam, not spamming, of course, but like,
yeah.
I don't know, that's intimidating to do. It's like, okay, you're reaching out to this person, you don't even know if they're going to
It's
respond back.
it's so intimidating. And luckily, this was like July 2020. I was doing these, so people were very
I
like
see.
work from home. Everyone was like remote, so it was a little bit like safety of my computer, and I was able to have these Zoom calls. But it was still very stressful. And then you get on these informational interviews, and this is like some senior professor at a university, and you're kind of nervous, and they didn't always go well. Like I had one informational interview where I thought I didn't end up
Wow.
applying even because I was like, oh, she just seems like not someone who's like very kind. And, this is someone you have to work closely with for,
Yeah.
4 or 5 years. I was like, I don't want to feel like I'm walking on eggshells. And maybe this person was just having a bad day, but it
Mm-hmm.
really rubbed me the wrong way. And my only thought was that, like, if I have to work with this person for 4 years and they're making me feel bad about
Yeah.
questions that I'm asking already, like, how are they going to make me feel when I'm
Yeah.
struggling with, data and like I need their help on analyses for my dissertation? So it ended up making me not want to apply. So But I will say that was the only one. Everyone else I spoke to was so nice and so lovely. And like I didn't have any other negative experiences, but it's very nerve wracking to like reach out to these people and you're just,
It's like imposter syndrome.
some person who's just
Totally.
like, yeah, very, very much so. Very much so. It's like, that you're qualified, but you're on this call and you're like, oh my gosh, this person's like does all this cool research and I'm just like this
Yeah.
lowly research assistant. Like, so
I
it's
guess
very
for
much,
like
yeah.
future advice, if someone's looking or listening to today's episode, like I guess what are some advice? So you kind of mentioned
Yeah.
someone, so definitely like networking, putting yourself out there. What's some other advice you might
Yeah.
have for a student, maybe even
Yeah.
reapplying for a PhD program, or even thinking about going down the PhD route because it's a big commitment.
Yeah. It's a big commitment. And then I would also say that one thing that's really important is that you should have like a specific research focus. I think that was a mistake that I made the first time I applied is that I applied like very general ideas that like, I'm interested in, access to care and strengthening
Mm-hmm.
things. And it was very general. And then when I reapplied, I was very concrete about what I wanted to do. Like I wanted to work in vaccine acceptance at the individual community level in international settings. Like even though it wasn't like this is exactly what I'm going to do, it was much more clear and much more well thought out and much more aligned with what I had been doing. So I had been doing this research for a long time. So there was like a nice thread between the research that I was doing and the
Mm-hmm.
research that I was proposing. That was a mistake I think I made the first time that I just didn't know. I didn't know you needed like this,
Yeah.
narrow specific idea that tied to your experience. That would be one thing is to like narrow your interest as much as possible and then making sure that when you apply this legwork that you were talking about is so important because you want to apply to work with someone who's
Mm-hmm.
also interested in that field. So because you're going to be working with them for so long, it's important to make sure that they're also interested and invested in the work that you're doing so that they're willing to help you a little bit more. So I think that's something that's really important that when you're talking to people, like be very clear about your interests and this is what I want to do. And, are you interested in this too? And if they seem excited on an informational call, like
Mm.
they're going to be excited in 3 years when you're, doing data collection for it. So I think those would be like kind of my three biggest pieces of advice. And then, of course, being financially prepared to take on 4 years of not having like a
Totally. Well, I
proper
think that that's
salary.
really applicable towards people
Yeah.
applying or thinking about the PhD program. So thank you for sharing that. We're lucky to have your perspective, and not
Yeah.
everyone is in your situation where you've kind of, well, obviously you learned that the hard way, and you're in a spot now. You're in a great program, so definitely, hopefully, your advice can be helpful towards somebody else, which is great. But
I hope
yeah.
so. And I hope people don't feel discouraged. Like I think, people
Mm-hmm.
remember the success stories and like if you look at my resume, it looks like, oh great, like, a PhD at Johns Hopkins, but what's not on there, is the rejection and the years of experience I had to get to build it. So I think just remember that a lot of people
Mm-hmm.
also don't get in the first time and some people do, but I would say many,
True.
many don't. And it's okay because you can just strengthen your
Yeah.
application and try again. It shouldn't deter you from trying
Well,
again.
great words of
Yeah.
advice. Baldeep, tell us where we can find you and what's next for you and your next this coming year, and hopefully we can have you again on the channel soon to talk about some other topics. But can you tell our audience where we can find you?
Yeah. So I can be reached on LinkedIn. You can just search my first and last name and I pop up. And also on Twitter, I think my handle is like bdolliwell5 or something like that. I have a Twitter. It is a little bit inactive at
You
the
have a
moment,
tweet.
but I do have a Twitter that I scroll, I ghost tweet, I ghost read now, but I'm still on it. I'm very active in the viewing. I don't do as much tweeting myself.
Okay, we can find you on LinkedIn. Awesome. Well, thanks for your time today, and
Yes.
hopefully we get to talk to you soon on another episode.